Coming now to the history of psychoanalysis, the rise is in late 18th to the early 19th century, primarily the work of Freud. If you look at DSM-1 and DSM-2, you will see heavy influence of psychoanalysis. It was after DSM-3 that DSM started becoming more and more theoretical. The first two DSMs were not really speaking theoretical. So the language of psychoanalysis was largely the language of mental health. So I was saying DSM-1 and DSM-2 were heavily influenced by psychoanalysis. They don't look theoretical. It was only after DSM-3 that this movement of being theoretical picked up in evolution of DSM. And in early time, language of psychoanalysis was the language of mental health. And there used to be words like neurosis, psychosis, borderline. So a break with reality, the psychotic spectrum. No break with reality, but any psychological difficulty, neurotic spectrum. And having characteristics of both, where you shift from one to the other, you look at the word borderline originally, not the way we use it today. Originally, we had these two words in psychoanalysis, neurosis, psychosis. And if you had characteristics of both, you were called borderline, which is a very different meaning of the word borderline than what we have today as a category in DSM. So that language of psychoanalysis was largely the language of mental health. And then the fall started from 75 to 2010, almost till 2000, I would say. And many factors were responsible. Rigidity of people in psychoanalysis, complete being closed, not open to ideas, supervisors pouncing upon new candidates, not allowing them to develop a free mind. The person was always afraid of the supervisor. And therefore, the conformity came in. When the teachers become too dominating, too persecuting, then the student, the first job of the student becomes to save himself from that attack. And in that course, one becomes a conformist. And the openness slowly closes. So there was a fall to 75, 2010, and then again it started coming up. Two things happened. One was
ये भी फेंक दीजिएगा।
Lacan came in with the idea of return to
मतलब अभी
Freud.
अभी इसी में कूड़ा भी रख लीजिएगा, इसमें है और उसमें भी रखा हुआ है। ठीक।
So Lacan came in with the idea of return to Freud. And this return to Freud happens every 25 years. It's almost like what happens in homeopathy, that after every 25 years, somebody will come and say back to Hahnemann. Same way, return to Freud happens every 25 years. And uh, apart from Lacan and some others who said return to Freud, two other things happened. ISTDP, which was based upon some of the core ideas of Freud, that started taking off. And second, psychoanalysis started getting used in film studies and in many other areas of humanities and social sciences. So much so that many of the concepts of Freud, they have become so much ingrained in everyday discourse that we don't even realize they are psychoanalytic in nature. Another development was neuropsychoanalysis, trying to study the confluence of neurology and psychoanalytic ideas. And then became a very interesting movement, which is at present on, which is use of psychedelics to explore the unconscious mind. And this is being used in experimentation in ISTDP and some forms of psychoanalysis. Can we use psychedelics to help therapy uh, be done quicker, deeper, and better? So, in my view, psychoanalysis is something very valuable and immortal to offer, and it has some limitations of its own, like any other area. But what it has to offer is very valuable and fundamental. So, I practice therapy which is psychoanalytically anchored, ISTDP informed, and informed by holistic considerations of uh, Hindu mysticism and spirituality. That is what I practice. So, this is the history, the rise, the glory, the fall, and the return of psychoanalysis. The history of psychoanalysis in India, Girindra Shekhar Bose was the first to really anchor psychoanalysis in India, and there is a lot of correspondence between him and Sigmund Freud. Girindra Shekhar Bose not only anchored psychoanalysis in India, he also modified it. He modified the methods. One of the things he used to do was to ask the person read certain parts of psychoanalysis and come back for the next session. And obviously, this would be very useful if in a conservative society we have to talk about something which is a taboo. Because one way to define psychoanalysis is it's a science of psychological taboos. And when taboo itself becomes subject of study, often in those times specifically, it may not have been easy to talk, so he would ask people to read and come. Sudhir Kakkar is in India has contributed a lot to psychoanalysis. He has some very good books. One of the books I would recommend is Doctors, Mystics, and Shamans. This is almost like a vernacular tour of places of mental health uh, healing which are going on in the unorganized form outside the pale of the official infrastructure. Lot of things can be done in the Indian context. You can talk about psychoanalysis in Indian spirituality. You will have my lectures in all the four areas in my channel. There are some lectures on psychoanalysis and Indian spirituality, psychoanalysis and idol worship. This is one of the areas of my interest. How psychoanalytic principles are involved in this whole process of idol worship and how you can turn that into a form of therapy. Psychoanalysis in Indian mythology, psychoanalysis and art. Now, what are the centers in India of psychoanalytic studies? Ahmedabad, you will have a Freudian center where I'm sitting right now, and a Jungian center at Civil Hospital. Delhi, you will have a center which is focused on Winnicott and some eclectic part at Ambedkar University. Mumbai, you will have a Kleinian center, Kolkata, Freudian center, Bangalore, a Jungian center. And globally, the centers are USA, you will find Freudian, ego psychology, self psychology centers. UK, you will find Freudian, Kleinian, Bionian, Winnicottian centers. And France, you will find very good Lacanian centers. Ethics, criticism, and limitations of
I
psychology.
have a question.
Yeah, please go on.
When you said about mentioned about Mr. Bose developing psychoanalysis in his region and also educating his patients about the basic principles or whatever. So I think that basically takes for granted that psychoanalysis is made for only the educated classes.
Uh, there are two aspects to it. Like, if we look at who is ideally cut out for psychoanalysis, we put this question: Or if we rephrase the question to say, is this method for universal application, or does this method work better on group A compared to group B? And if that is so, then what are the characteristics of group A on which this method works better? So if that is the question, then the qualifying criteria would be that this is a method where people are ready to invest cost, time, energy. 1. 2, this is a method which is of long duration. People ought to have patience. 3, this is a method where one has to have the capacity to face one's difficult feelings. And 4, this requires some sort of a minimum intellectual capability and interest in the inner world. There will be many people who will say, I don't like this coming every day and talking about thoughts and feelings and life. Just give me a pill and forget about it. So that group is not cut out for psychoanalysis. There will be some people who will say, I am okay if you give me a structured approach to therapy. Now they are cut out for CBT, where you will say, for the next 12 sessions, we'll focus only on this problem, and this is how you will proceed, session 1, session 2, session 3. So your question is correct that there are groups of people who are not ideally cut out for psychoanalysis and groups who are cut out, and this method works better when somebody is ready to invest cost, money, time, somebody is ready to face difficult parts of himself, somebody has the capacity to bring out those feelings, somebody is interested in the inner world, and somebody has a minimum intellectual capability. If those criteria are not there, it's difficult to apply this method. So in the Indian situation, there will be a large section of population which is not ideally cut out for this method. And therefore, you will have to customize this method to a large degree to be applied to the Indian population. But the good part is India's population is so large that even if it's applicable to 40%, you are still talking of crores of people. It's still larger than Europe. Does that answer, or is something remaining? Okay. So let's come to ethics, criticism, and limitations of psychoanalysis. The ethical part is the cost, time, and capacity. In classical psychoanalysis, we believe if you don't go 3 times a day, 3 times a week, it is not psychoanalysis. This is the original classical thinking, that psychoanalysis means 3 to 5 sessions a week. Freud actually used to practice 5 sessions a week. In some cases, 3. So 3 to 5, less than 3 is not psychoanalysis. Practical situation in India is most people don't have the time or the money to really pay for 3 to 5 days a week. So practically, we do 1 day a week or 2 days a week. That is the practical outcome of it. Time-wise, psychoanalytic sessions, Freud used to take 50 minutes. People customize it today to 45 minutes or 1 hour. Freud used to have 50 minutes because he could not control his addiction of smoking, and every 15 minutes he would need a cigar. So Freud did 15 minutes out of his own addiction, but people customize to 45 minutes or 1 hour. I practice 1 hour. It requires capacity in terms of energy, intellect, and capacity to feel. And in terms of social needs versus individual needs, psychoanalysis is more focused on the individual. So if it comes to a choice between individual and collectivity, psychoanalysis will tilt towards the individual. So that has its own ethical questions in a society which is largely collective, like India in its nature. This brings us to an important question. If the cost, time, qualification, interest in the inner world, they exclude a large section of people, then what about social responsibility of this area? And a lot of people have thought about it, and 2 solutions have come. One is group therapy, where you can have 7 people together and you do therapy in a particular way using psychoanalytic principles, but in a group way. Wilfred Bion developed this to a great extent. Group therapy. He has a famous book called Experience in Groups. So groups therapy is one way you can make it more democratic, more available, and you can also overcome the shortage of therapists. Problem with group therapy is many people are not comfortable because it's not anonymous, and there is a paradox. They can't afford individual therapy and they can't go into group therapy because of anonymity. So I have tried one model, which is a WhatsApp based model, and Bhavna and Maitri, who are part of our group, uh, we experimented together with a WhatsApp based model. That can be one solution, but there is an ethical question about cost, time, and everything that stands for psychoanalysis. Criticism is it is more of a Western elite construct. It's open-ended, unstructured, and the effectiveness is in question. This largely depends upon the therapist. I would say the effectiveness is a very uh, strong function of the therapist and his training and his personality rather than the discipline of psychoanalysis per se. But there's a question. Some people say return on investment is too low, which is not actually true if you have a good therapist. In fact, the return on investment is much higher. What are the limitations? It takes time to learn and practice. It cannot be done quickly like CBT, REBT, or DBT. You have to get into cultural compatibility and customization. One has to be on guard. Many people, many therapists in this area, they get carried away by narcissistic self-righteousness and rigidity. And they become close to other schools, other approaches. They become close to spirituality and holistic healing. And this takes long, not because we want it, but it is because nature presents us with mind which is such that it is not easy to go through the mind into its depth quickly. So it is the constraints of nature rather than the constraints of only of therapy. Because whatever therapy method we choose, the resistance is not going to be zero from the other side. And the resistance is natural. It is not that anybody consciously thinks to be resistant and becomes resistant. So the nature of truth is such, the nature of mind is such that it takes a minimum time. Even the quickest of therapies, they also take time. So these are some of the ethical considerations, criticism, and limitations.
Sir, I have a question here.
Please.
Some of the cases I have seen where people have this, tendency, which can be an attribute of resistance, but generally also in their life, they would say that I don't remember much of my childhood and teenage, even in their as early as 30s.
Right.
So, is it a psychoanalytic work in process which is showing a resistance and shutdown? Because it is not just happening in the therapy room. They
Yeah.
sometimes say it that हमें usually कुछ भी याद नहीं है ज़्यादा कुछ हाँ I don't remember, they don't have visuals, they don't remember much. So what
Right.
is happening to such people?
Usually we look at two different things. Let us say we rule out mental retardation. We rule out that part. A normal, fluent, proficient person comes with this. We will be looking at two or three things. The most usual is repression. That events which are happening are so painful that the unconscious mind decides to repress them, and therefore there is a loss of memory that you just don't remember. And this over a period becomes habit of dealing with difficult things in life, and therefore too much is repressed. The second component can be a vertical split, which is there in very few, but a vertical split in personality, what we would call the multiple identity disorder. One part does not remember the other, but that is very dramatic. It will come out if it is there. The third component has to do is with some groups of artistically oriented people where there is a unique type of a cognitive thought disorder where they just can't hold on to anything or remember anything. And the mind is in a constant state of disintegration, integration, talent, eruption, again disintegration. A strange kind of cycle goes on. But the most common will be repression. So what is
But
happening is
even if
कि,
it is like there is no,
yeah. So what is happening in those cases is कि even when they were not in therapy, the repression was always at work. And after they come to therapy, this becomes noticeable and it increases because you're probing the very areas which they don't want to get into.
can there be also a reason like if there has been too much of comfort right from the childhood, right? And not much of involvement in any of the things. The person has not developed the muscle to process any of the processes, the psychological processes.
Correct.
And that is why the ego self is not very well segregated in, you know, those timelines. Can that also be one of the reasons? Too much of
Yes.
ease of parenting and too much of comfort and not involving in anything.
Correct.
Can that
So,
also be one of the reasons?
yeah, it can be definitely because this is the capacity argument
Okay.
that the generation of emotion is very high and the capacity to deal with it is very low. In some cases, we will see that the capacity is okay, but the generation is very high.
Right.
So that will be a different situation. They may have the same outcome, but
Hmm.
there the difficulty will be of generation being very high. So in their case, there will be partial amnesia, but a large amount of
Hmm.
energy or the whatever is the
Hmm.
generation emotion that will be given out in something which is related to acting out.
Hmm.
Now that may be violent behavior. It may be
Okay.
histrionicity. It may be manic behavior.
Hmm.
So there you will have a situation where the defenses are fine, but the generation is too much.
Hmm.
Again, we will have a
Right.
capacity
So
problem.
that means in
Huh, please.
capacity problem. That means in patients with capacity problem, both the lesser the capacity or too much of generation problem, psychoanalysis uh, is actually very much useful. But we might have difficulty in the beginning sessions because there is nothing much to talk about of your childhood.
Correct. Because it will take a lot of sessions to really break into. And
Right.
two things are very important. One, the patient must see the therapist as a very good object, a
Hmm.
very safe and supportive object, number one. And number
Hmm.
two,
Hmm.
unconsciously he will project,
Hmm.
unconsciously he will project emotions into you which he himself cannot handle
Right.
by a mechanism which we'll do later called projective identification, which means if I am angry at you, you start feeling
Hmm.
angry at me.
Hmm.
Right? I have put my anger into you. How people do
Hmm.
it, nobody knows the mechanism, but the mechanism is not in question. Every
Hmm.
therapist experiences it practically every 3 or 4 sessions. So
Right.
there what happens is the question comes of containment, that
Hmm.
a person who is not able to handle his anger, he puts it into the therapist. Now, if the
Hmm.
therapist is well trained, he will
Hmm.
know that the anger arising in him is from the other person. And he
Hmm.
will keep looking at it, observe it, and interpret it to the person if necessary, and
Hmm.
not get angry. If you are not
Hmm.
well trained, you act out that anger. And that
Hmm.
then threatens the person that he unknowingly knows that you don't have the capacity as a therapist to handle his anger.
Hmm.
So, what this
Right.
group of patients will do is first they will check out if you are safe, positive, and second, they will check out your capacity to contain their anger. If both
Hmm.
of them are going good, over a period of few sessions, something good will happen.
Okay. Okay.
Because all capacity patients will check out your containment capability.
Right.
Because they are borrowing the capacity from you in a way.
Hmm.
And then by internalization, they will learn it.
Right. Thank you, sir.
Thank you. So the education model of psychoanalysis always has been based upon a tripod model, meaning it's a table which has three legs. One leg is of teaching, where we go into the theory of the schools, model of the mind of each school, pathogenesis of each school, and the healing method of each school. And we talk about what is called technique. Technique means what do you do in the therapy room? Say, for example, you have a session 12 to 1. It is 12:10 and the patient has not come. Should you call the patient or not call the patient? Let us say the session is over and both of you are going out of the clinic and both of you have to take the lift and go down. Should you go in the same lift with the patient or should you allow the patient to go first and then follow later? If the patient says, "Can I give you a lift?" should you take it or not take it? So these are the questions of how to do therapy. We call it technique, the questions of technique. So technique is a part of psychoanalysis where we go into what happens inside the therapy room and how to do it correct. So in teaching, we go into concepts and we go into technique, theories and technique. The second leg is into analysis of whoever wants to learn. So if you want to learn psychoanalysis, you have to undergo your own therapy for 500 hours, which usually is 2 years if you do 3 sessions a week. So I did it myself. I underwent 500 hours, 2 years. Everyone has to do, but it's very costly. The third is supervision. You start treating patients under supervision and you get supervision for 500 hours of your therapy sessions. It's not practical, so people settle actually for 100 hours. So there are 3 legs of psychoanalytic teaching, learning, education. One is conceptual knowledge. Second is your own therapy. And third is you seeing patients under supervision and getting feedback from the supervisor on how to improve. So what we will be doing is teaching we will be doing, supervision partly we will be doing, therapy we will not be doing because that's a very costly and difficult part. So this is how the classical model is there. We'll be addressing teaching fully, supervision partly, training analysis we will not go into. Now let us go into each of the psychoanalytic schools and what is the core concept that is at the center of the school. For Freud, the core concept which was generating pathogenesis, which was generating pathology, was sexuality. So for Freud, sexuality was very important as something which generates pathology. For Melanie Klein, aggression and envy was very important, more important than sexuality. For Wilfred Bion, aggression, envy, and containment were very important. We'll go into definition of each of them, don't worry, later on. For the moment, just presenting a snapshot. For Winnicott, good enough mothering of early childhood was center. For Kohut, healthy, admiring, empathizing, good enough people around us in early childhood was the center. For ISTDP, bottled up anger, sadness, and guilt is at the center. For Jung, individuation and archetypal working is at the center. For Margaret Mahler, fusion individuation was at the center. We'll come to it, what it means when we do it. For Lacan, desire, primal disintegration, and unconditional love, these are at the center of pathology. For Hindu spirituality, desire, karma, self-journey, enlightenment, these are at the center of suffering. And the method that I have developed, HEAT, in that desire, karma, self-journey, enlightenment, and lot of things above, sexuality, aggression, self-formation, they are also put in there. It's a kind of consolidation. So each school has its own center and something that it thinks is very important. So obviously, when you practice a school, the way you do therapy, the way you do case history, the way you talk to the person, all of them gets a flavor of whatever is at the center of the school. If you are a Freudian and a patient comes and you take case history, obviously your questions will be more on sexuality. If the same person goes to a Kleinian, the questions in case history will be more related to aggression and envy. So each school has its own central focus concepts, and everything in that school gets colored by it, whether it is case history, pathogenesis, psychological testing, healing, everything is colored by this centrality of some concepts. Now, how will we go about in this course? This is the structure in which we will go. We will take up schools one by one after the introduction is over, and we will start with first introduction to the school, introduction to the founder of the school, then we'll go to core concepts, then we will go into original writings of the founder, then we'll go to application, which are of two types, clinical and non-clinical. In clinical application, I will request all of you to bring cases and we can apply what we learn in those cases. And we can arrive at pathogenesis and the healing method for any given case using the concepts we have learned. So in clinical application, we will be using the conceptual knowledge for case analysis, dream analysis, supervision, and if you want to apply to yourself, you can apply it to yourself. In non-clinical application, we will apply it to art, mythology, spirituality, or we can apply it to everyday. After doing this, we will go to criticism of the school, what are the limitations, and then we will take a holistic perspective of how the school has evolved over so many years. So this is how the structure of each of the schools will be. Introduction to the founder, introduction to the school, core concepts, clinical application, non-clinical application, criticism, holistic perspective. In terms of number of sessions, how will it go? Freud will take the longest. We might need almost 25 sessions for Freud, 25-30 sessions. Other schools will take much lesser. So average will be 10 to 12 sessions per school. Freud will be the longest, others will be much quicker. And we will take an applied orientation. So we will take up only those writings of those people which are more useful in the practice of psychotherapy. So this is how the session structure will go. This will be the study material. My book, Affective Psychoanalysis, books by founders. Now this will divide the schools into two. Some school founders are very good writers. So it's easy to read in original and we can start from there. Some writers are very opaque, very difficult to read. So in those cases, what we will do is, first, I will explain the core concepts and then we will go to the original. Or we might go to some other author who explains those people better than they express themselves. For example, in Carl Jung, I will explain the core concepts and then we'll take up a book by Anthony Stevens. He explains Carl Jung much better than Jung explains himself. And then we will go to Carl Jung in the original. And of course, original, we can take only small parts, whatever the time permits. Otherwise, the original is very extensive. Freud has written almost 5,000 pages. Carl Jung would have written probably the same or even more. So we can't go line by line, but we can go chapter by chapter of the chapters which are important from practice point of view. So this is how we will go into it. I'll be sharing some videos, some films on the group. And if you want to read more, go on the Essential Paper series. This is a series of books. It is like essential papers on depression, essential papers on dream analysis, essential papers on bipolar. Every personality disorder, you will have an essential paper book. Essential papers on anxiety. On the major themes of psychological suffering, you will have one essential papers book, and it is a collection of very good papers. So if time permits, I'll be sharing some of those papers. So this will be the study material. Any questions that you have, you'd like to answer? Yeah, please.
Sir, when do we pay the fees and how do we pay the fees?
You can pay online, offline, whatever is comfortable. You can pay after the month, you can pay before the month, completely up to you. And
Same number? Same number?
yeah, same number, same phone number. And I
Okay.
also don't know how long this will go, because it all depends upon how much discussion and how many cases we bring in. So I have kept the entry and exit month-wise. Anytime month you feel like you can enter, you can exit. And any questions on introduction part? Don't worry about the concepts and the big names that I have dropped today. As we go in, it will become very simple. Yes, please. Any questions, or we can stop for the day? We have crossed the time already. Fine. Then let us, yeah. Yeah, please. Any question?
Thank you. It was very nice. Thank you.
Oh, too much we covered today, slightly fast, but I think next time onwards we should go slow. And let me see if I can get the Zoom so that we don't have to stop every half an hour. Make it better. Yes, it will be available. I'll be putting up the videos today on that YouTube channel. I'll send the link in the WhatsApp group. And later on, I will try to make it paid. I don't know how to make it paid. Get somebody technical to do it. For the present, I'll just put it up so everyone can see. Okay. Thank you so much. See you again next Monday.